Hello, friends. Let's today talk about reasons for hip pain. So let's first understand what is our hip made up of. Normally, our hip is made up of two components. One is the ball component and the other is socket component. The ball component is known as the femoral head and the socket component is known as the acetabulum. In short, we can say that hip joint is basically a connection between the leg bone or the thigh bone known as femur and our pelvis. So this joint in itself is a very powerful joint, a very strong joint, and it is surrounded by equally strong muscles, ligaments, and tendons. Now, let's talk about the most common reasons for hip pain. So when we talk about the bone-related causes or the joint-related causes, the first is the osteoarthritis or the arthritis of the hip joint. In this, the cartilage layer of the hip joint, it starts wearing off. So this is most commonly seen in elderlies above the age of 60 years. Second, which is more common in young age, is a vascular necrosis in which the blood supply to the femoral head part reduces and there is a shrinkage of the head that leads to arthritis of the joint. Third most common reason for hip pain is inflammatory arthritis like rheumatoid arthritis or ankylosing spondylitis. Rarely, infections can also destroy the hip joint. This could be tubercular or non-tubercular in nature. Or sometimes if there's a history of hip dislocation, that can also lead to hip pain. There could be other reasons also, like if there is a fracture in the neck of the femur bone, which is more commonly seen in elderly population. This normally happens because of an injury or a trauma. In athletes or in patients with osteoporosis, even stress fracture of the femoral neck can happen. This can also cause pain. Sometimes the bone is normal, but there's a problem with the soft tissue around the hip joint, like in Trochanteric Bursitis, which is a sort of a fluid-filled sac that can undergo inflammation and cause pain. Also, if there is a tendinitis or muscle strain like gluteus medius or gluteus maximus sprain, that can also cause pain around the hip joint. Sometimes pain in the hip can be because of problem related to lumbar spine also, which is known as the radicular pain. So normally, a hip joint pain starts with a pain in the groin or the inner part of the thigh. This very well points towards hip joint pathology like arthritis or avascular necrosis. If the pain is on the outer part of the hip bone, that is the trochanteric bursitic region, that means it is because of trochanteric bursa inflammation. This is normally towards the outer part of the thigh known as the lateral part. If pain is on walking or standing, it is normally a sign of early arthritis. If there is stiffness and you find difficult to wear your shoes or socks, then it is a sign of advanced arthritis. Sometimes there is a locking or clicking sensation in the joint. This is probably because of some loose body or labral tear. So normally, if you are suffering from hip joint pain, your doctor will ask for an X-ray or an MRI. X-ray can very well pick up things like AVN or fractures or deformity or arthritis in later stage. If your X-ray is coming out to be normal, then MRI may be required to detect early avascular necrosis or labral tears, sometimes cartilage loss also. Normally, blood investigations are only required if we are suspecting something like rheumatoid arthritis or ankylosing spondylitis. Sometimes we go for ultrasound or ultrasound guided injection also. In case there is a hip joint pus or infection, then we aspirate that pus out using ultrasound. Like any other joint or any other pathology, the first treatment is always non-surgical. We start the patient on painkillers or anti-inflammatory drugs or muscle relaxant. We ask the patient to go for physiotherapy to strengthen the muscles. And also we ask for lifestyle modifications like reducing the weight or sitting cross-legged or to wear good shoes while walking. If nothing helps, then only surgery is required. If there is advanced arthritis of the hip joint, then we go for hip replacement surgery in which we change the ball and the socket part of the hip joint so that the overall movement of the hip joint again becomes smooth. Sometimes if there's a fracture like femur neck fracture, we go for surgeries like hemiarthroplasty or Hufter, what we call, in which we replace only one part of the broken bone. So overall, if you are suffering from hip pain, don't worry, visit your doctor. Your doctor will advise you the correct treatment based on what your X-ray or MRI is showing, and based on that, he will guide you further. If you have any doubts related to hip pain or hip arthritis, feel free to contact us on the numbers shown below. Thank you.